Door-to-door visits will be conducted to persuade people to take up the vaccine. Amid increasing community cases, measures could also be tightened ahead of Chinese New Year. These were revealed during an interview with multi-ministry task force co-chairs, Health Minister Yong and Education Minister Wong. As Singapore marks the first year of the task force, both ministers also spoke on various aspects of the pandemic, including very different views on how long Singapore will remain in pandemic mode.
We will still largely be in this sort of pandemic mood, right? Over a 4-year time frame, 5 years, who knows exactly when, but at some point the pandemic will pass. Surely, no pandemic is forever. Either the world gets vaccinated and achieves herd immunity, or the virus attenuates and it's no longer as deadly.
The next pandemic is not very far away, and Lawrence talked about 4 to 5 years before we can get out of this. I was thinking to myself, this is one point I may disagree with him, because over the next 4 or 5 years, I'm quite sure the next pandemic will happen.
The task force co-chairs noted that Singapore is not alone in this world, and the new infection records being set elsewhere remains a worry for them. But they assured that Singapore is entering 2021 with more capabilities to tackle COVID-19, from better tracing and testing to vaccinations, which will remain a focus for this year.
They do need to make a booking, so it's not easy for the seniors, and we have no choice but to really do it the hard way and to go house to house, person to person, to explain to them, to answer their queries, to reassure them, and to persuade them to go online and to book for the vaccination.
And if you want to wait, you must accept the consequence that perhaps if you wait later, if the vaccine supply has been taken up and you want to take it up later on, you may not have the ready supply.
With Chinese New Year just round the corner, more intermingling is expected due to festivities and house visits. And given the recent resurgence in local community cases, the ministers said they are mulling over whether additional safeguards may be necessary. The co-chairs also looked back on the past year and the challenges they faced. Enforcing the circuit breaker in particular was a very tough decision that they had to make.
All these decisions that you never know, right? I mean, when we entered into a circuit breaker, there would have been people who said that's too drastic. There will be some who said, look, it is necessary. Why didn't you do more early on? It's a judgment call.
Mr. Gan also acknowledged there were some grey areas in the rules.
If you stay together, 10 of you stay together every day, and you go out to eat together, actually it doesn't really have higher risk. But at the same time, it's very difficult to enforce on the ground, very difficult to explain to the table next door that, you're from the same family, same household, and how do you define?
Both ministers added that public sentiment did weigh on their decisions and policy design, but at the end of the day, everything was done in the interest of public health and protecting the people from infection.